Right now, today is International Malaria Day. Almost half of the world's population, an estimated 3 billion people, live in areas where malaria is transmitted. Endemic to 107 countries in the tropics and subtropics, is responsible for around 1 million deaths across the world every year, with sub-Saharan Africa the largest hit. And Dr. Adegbola, Senior Registrar at the Department of Community Health and Primary Care at the Lagos University Teaching Hospital, is on the line to give us some perspective on the moves to tackle malaria in Nigeria. Thank you so much, Dr. Adegbola, for joining us on the show. I want to start by maybe getting your thoughts about how the progress we're making, if any, in tackling this crisis in Nigeria.
Okay, thank you very much. As we all know, as I've been introduced earlier, malaria is endemic in sub-Saharan Africa, and especially Nigeria. Today being the World Malaria Day, April 25th of every year. The theme for this year is Invest in the Future, Defeat Malaria. And concerning progress, yes, we are making progress at every angle in combating, that is preventing and in controlling malaria. Because it's a major killer disease. It's an infectious disease, but it's preventable.
Right, and I guess that's what it started about this. And one gets a sense that community health care programs will be crucial in curbing the spread. So can you just speak to the type of programs we're seeing in Nigeria right now?
That we are doing in Nigeria right now. There are several programs. There are screening for prevention, for example. They make sure starting from pregnancy, because when you're talking about prevention, which is the major thing in malaria, we talk about primary prevention. And this starts from even while the child is in the womb. That's starting from pregnant women, because we know that it accounts for about 11% of maternal death in sub-Saharan Africa. So we start with taking prophylaxis from pregnancy. Every pregnant woman has the advantage of having intermittent presumptive treatment, which is prophylaxis that is used during pregnancy to prevent the maternal death, malaria from attacking the mother, which could cause delay in growth of the child and even eventually affect the child too. Because pregnant women and children under 5 are the most vulnerable group when it comes to malaria.
Okay, but do you get a sense that we are making progress? What I heard is that in 2010, over 260,000 deaths were traced to malaria in Nigeria. And I want to get a sense of whether or not that trend is improving or is it getting worse?
No, we are improving. We are improving. Which is why the theme for today, for example, when this World Malaria Day started in 2007, it started in 2007 during the World Health Assembly, and it was to invest in to attract investment and political commitment. For every pregnant woman now, you are entitled to that. Apart from the intermittent preventive treatment, they give you insecticide treated nets. Because all of these are given free. For example, in Nigeria, they give all this free to pregnant women to prevent this infection. And so definitely we are making progress. We are attracting the political commitment. A lot is being spent on malaria because, like I said earlier, it's a killer disease and it's very endemic. It is with us in Nigeria.
What about foreign partnerships? I imagine that will also be crucial, given what we've seen in things in the treatment of issues like polio. Clearly, collaboration with the rest of the world has been important there. So can you speak to what we're doing in that respect?
In that respect, of course, there are funds. There are global donors towards malaria. You know, we have people that subsidize most of these things that we use. For example, the net, even the drugs, the drugs that are being used either for treatment or for prevention. We have donors that subsidize them and also actually donate such drugs to endemic countries. And there are several of them. There's global donor for malaria, which, for example, look at Millennium Development Goal, malaria, TB, and HIV are among those diseases that we are really focusing on eradicating or reducing by 2015 among the Millennium Development Goals. So, of course, definitely there are global funds towards reduction of malaria and eventually eradicating malaria.
Right. You just mentioned the Millennium Development Goals and, of course, the 2015 targets. How optimistic are you, though, that we will hit those targets?
Oh, well, this is 2013. And if we look at the incidence, the prevalence of most of these diseases, we can only hope that at least we will achieve some reduction rate by 2015. We can only hope we will achieve some reduction rate, not exactly the rate they want us to achieve. Reduction of this by 75% and all of that. We might not be able to, but definitely we are looking at definitely getting some reduction rate, and then looking at post-2015. We are not talking about post-2015, still going ahead with most of these programs to reduce them.
So I think what you're saying is that probably after 2015 we may hit those targets. But if we move on to, say, what is going on in the north, clearly the insecurity is something that worries for different reasons. But to what extent is this impacting the programs, the community health programs in that part of the country?
In that part of the country, yes, because in everything there should be security. Security is important. You understand? So when we don't have security, for example, medical personnel, many of them are being. We all know about the polio thing that happened, where medical personnel were, killed, unfortunately.
Right.
So a lot of medical personnel are either leaving the north or running away from the north. And of course, if you don't have these people on ground, then who then takes care of the children, the mothers, at least those vulnerable groups, and even the society at large? So definitely, yes, it's impacting the program. It's definitely impacting the program.